Hi all, welcome to EJU's online education program. It's about nurses who are preparing for the exams to the Gulf countries like Oman, Saudi, Bahrain, Kuwait, etc. So many of the candidates are having difficulty to study the theory because of the duty timings. They are not able to attend the online live classes or offline classes. And many of them, what they do is that they by heart the materials which they get from the social media and they directly go for the exams. As a result, they are not able to score the proper required score for their exams. For all these problems, we have found a solution, which is EJU's online app. Okay, so mostly the pattern of the question is that there will be a scenario, and below that there will be 4 options, and we have to select the correct answer. So most of them, because of the lack of theory knowledge, they are not able to select the correct answer. Okay, so we are providing a solution for that. In the question discussion section, we not only provide the right answer, we explain about the condition and the rationale of the right answer. Okay, so we have uploaded classes in addition to these question discussions in our app. So it is easily understanding, so that it helps to clear the exams properly and you will score high marks. If you study the materials and the question discussion properly according to our instructions, we assure that you will get the required marks and you will pass easily. Okay, coming to the features of our online app program, it is a 35 hours online class in which there is HD video classes which we have already recorded and uploaded in our app. And second, we also have PDF materials in which there are questions which have come recently for our exams. Okay, and third thing is we have mock test, so that you can practice questions and you can check that how far you have improved your knowledge. And fourth, we have exam mode test, in which you can practice the questions just like how you prepare for your exam or how you attend in the exam center. Okay, so all this helps you to gain knowledge and also to score high marks. Okay, there are some additional features which we provide. First thing is that you will have individual faculty assistance. Whenever you have doubt, you can clear the doubts with your faculty who are available in online, or you can call them and you can clear your doubts. The most important feature of our app is that convenience. You can watch the theory classes according to your time. There is no time frame inside our app, so the duty problem will not be an issue. Whenever you are free, you can watch, and you can watch any number of time you want. Okay, then recently asked questions. We have a WhatsApp group in which we discuss with the students or candidates continuously. We make sure that they are covering the topics properly, and we also provide them recently asked questions given by the previous attended candidates. Okay, and we are daily updating the questions inside our app, so please watch it. If you like this video, like, share and subscribe. Please share it to your friends so that they also get benefit from our app. So these are the facilities we provide. Thank you. Hi. The nurse is performing a physical examination to client with hearing difficulties. The nurse activated the tuning fork and placed it on the top of the client's head. What test did the nurse perform? A. Whisper test, B. Rinne's test, C. Audiometer, and D. Weber test. So these are the 4 tests which we use for patient who is having hearing difficulties. But here the question is, nurse activated tuning fork and placed it on the top of the client's head. So there are 2 types of tuning fork test which is used for hearing loss patients. One is Weber's test, and second is Rinne's test. In one test, tuning fork is placed on the top of the head, and in second test, the tuning fork is vibrated and placed first on the mastoid process, and then it is moved towards the outer ear. So here the question is, tuning fork is placed on the client's head, top of the client's head. So what is the name of the test? So this is the test. Here the examiner will vibrate the tuning fork and will place it on the forehead to assess the vibration and where the client feels the vibration. Normally the vibration is felt equally on both ears. If it is lateralized to any ear, and based upon that lateralization, we will diagnose that whether the patient is having conductive or sensory neural hearing loss. So, here the question, the only question is that examiner is placing tuning fork on forehead. What is the name of that test? So, the test in which the tuning fork is placed on the forehead is known as Weber test, and the test in which tuning fork is placed first on the mastoid process and then moved to the outer ear is known as Rinne test. Okay. So, here question is on the tuning fork is on the top of the client's head, and so answer is Weber test. Whisper test is a test in which the examiner whispers near the ear of the patient and will check whether patient is able to hear it. Audiometry is also a test in which the examiner uses his speech or sounds or musics to assess the hearing ability of the patient. So, here the question is about tuning fork, which is placed on the top of the client's head, and hence the answer is Weber test. Next question, a 62-year-old man present to the clinic with complaints of hearing loss in the left ear. The hearing loss has been progressive over the past year. A semi-transparent, a pale grey color and tympanic membrane and clear of cerumen. A Weber test is performed and the sound is lateralized to the right ear. Which type of hearing loss is suspected? So, just as we discussed in the previous question, here the Weber test is done and the findings has been done, and based on that finding, what should you conclude? So, that is the question. So, let us see the question in details. Man presents to the clinic with what is the complaint? Hearing loss in the left ear. Okay. And Weber test is performed in which the tuning fork will be placed on the forehead, and we will ask the patient on what side the patient feels the vibration. So, as I said, normally the patient hears the vibration equally on both ears. If the vibration is lateralized, if the vibration is felt only on the affected ear, it is conductive hearing loss of that ear. Okay. If the vibration is lateralized towards the affected ear, it indicates conductive hearing loss of that ear. But if the vibration is lateralized to the opposite ear, which is normal ear, it is due to sensory neural hearing loss of the opposite ear. Because there is nerve damage in the left ear, patient will not hear the vibration on the left side, patient will only hear it on the right side. So, if the vibration is lateralized towards the affected side, it is conductive hearing loss. But if the vibration is lateralized towards the normal ear, it is sensory neural hearing loss of the opposite ear. Now, let us go back to the question. As we said, patient is having hearing loss in the left ear, but while performing Weber test, the sound is lateralized to the opposite ear, which is right ear, which is normal ear. So, the hearing loss is sensory neural hearing loss of the left ear. So, left sided sensory neural hearing loss is the answer. You can see the options: left sided conductive, B right sided conductive, C left sided sensory neural, D right sided sensory neural. Because the sound is lateralized to the right ear, the patient is having sensory neural hearing loss in the left ear. Next question, following a lumbar puncture, a patient has several complaints. Which of the following statement indicates that patient is experiencing a complication? So, after lumbar puncture, patient shows several complaints or patient complains of several problems. Out of that, which statement indicates that patient is having a complication? So, one of the important complications after lumbar puncture is spinal headache. Due to the leakage of spinal fluid or loss of spinal fluid, patient will experience a headache, which becomes severe when especially the patient is in sitting position. So, this is the feature of spinal headache. Management is, following lumbar puncture, you should place the client on supine or flat position for 6 to 8 hours to prevent the leakage and to relieve the headache. So, let us see the question again. Following a lumbar puncture, a patient has several complaints. Which of the following statement indicates that the patient is experiencing a complication? Options: I have a headache that gets worse when I sit up. I am having pain in my lower back when I move my legs. My throat hurts when I swallow. I feel sick to my stomach and I am going to throw up. So, the complication, as I mentioned, is the spinal headache, in which the patient will have headache while the patient sits up. So, look at the option A. I have a headache that gets worse when I sit up. So, this is the feature of spinal headache which indicates complication, and so the answer is option A. I have a headache that gets worse when I sit up. Next question, which of the following describes functional nursing? So, this is also an important question. Here they are asking about the definition of functional nursing. So, based on nursing care, it is divided into 5 main categories: primary nursing, focused nursing, functional nursing, team nursing and total patient care nursing. In primary nursing, a single nurse is appointed for nursing care for a specific period of time. Only for a specific period of time, a single nurse will be responsible. In total patient care nursing, a single nurse will be responsible from the beginning, starting from the admission till the discharge. A single nurse will be responsible. This is known as total patient care nursing. Okay. In team nursing, just like the term describes, there will be a team, and all together they will divide the duties within themselves and they will provide the care as a team, is known as team nursing. In focused nursing or centered nursing, the nurse will focus on a specific area of the body, for example abdomen or thoracic cavity. Like that, a nurse will focus on specific body part of a patient, which is known as focused nursing. Okay. Here the question is about functional nursing, and in functional nursing the focus is mainly on the task or care rather than on the patient. So, a care which focuses on the care task given is known as functional nursing. So, while seeing the options, option E emphasizes on continuity of care and responsibility. Option D, ratio of patient care means staff patient ratio 1:1 or 1:2, like that, which is known as ratio of patient care. And centered care is also known as focused care, in which the nurse focuses on specific area of the body. And B involves a group of nurses working together, which is known as team nursing, to identify, plan, implement and evaluate the patient. Option A, task and activity oriented care, in which main focus is on the task or activity provided to the patient. So, definition of functional nursing is option A, which is task and activity oriented care. So, the answer is option A. Next question, when the client imitates or repeats what the nurse says. This is an example of, this is a psychiatric question. This is an important feature which comes under schizophrenia, in which the patient repeats whatever the words said by the nurse. So, it will be like an echo. So, hence the name Echolalia. You can see 4 options. Option A, Clang association. Option B, Echolalia. Option C, neologisms. And option D, word salad. Word salad means client mixes several words and phrases, which will not be a proper sentence, but in that sentence patient mixes several words, is known as word salad. Neologism means client makes new words which are meaningless. The words they create will be meaningless words, which is known as neologism. In Clang association, patient uses several words, but all the words will sound similar. So, when the patient uses several words which sound similar, it is known as Clang association. Here the question is, client imitates or repeats what the nurse says. So, it just like I said, it will be like an echo, and hence the name Echolalia. Okay, next question. Which of the following psychiatric term best describes this symptom? While talking, the psychiatric patient repeated the same words stated by the nurse. This is the same question which has been asked in a different mode. The meaning is same. The patient repeated the same words stated by the nurse, which is known as again echolalia. Okay, there is another word similar to echolalia, which is echopraxia. Echopraxia means imitation of the movements by the nurse. Here the words are repeated, and if the movements are repeated, it is called as echopraxia. When the patient repeats the movements of a nurse, it is known as echopraxia. When the patient imitates the words of a nurse, it is known as echolalia. So, here option B is the right answer. Next question, a nurse is interviewing a client with schizophrenia. When the client begins to say kite, night, right, height and fright. So, nurse documents this as. So, in the previous question we discussed about a condition known as Clang association, a feature which is seen in the schizophrenia. In Clang association, just like we said, the patient uses several words which sounds similar. If you look at these words, kite, night, right, height and fright, all these words sound similar, and so it is known as Clang association. So, answer is option C, Clang association. So, just look at the statement. If the patient is repeating the same words, it is echolalia. If the patient is using the words which sound similar, it is known as Clang association. And if the patient uses several words which is not a proper sentence, it is word salad. And if the patient uses new words which has no meaning, it is known as neologism.